All right. Hello, everyone. Thank you for joining. As always, today we have a special guest here, Dr. Ashley Burton. She's a chiropractor and holistic nutritionist. And I'm hoping today we're going to be able to cover a lot of ground about women's health and maybe PCOS and birth control and fertility and even babies. All kinds of stuff. Dr. Ashley Burton, can you tell us a little bit about yourself? Where do you come from? What do you do?
Thank you. Yes. Where do I come from? Well, I actually was born in the town that you probably are recording in right now. So I am a Northern Ontario girl originally, born in Kirkland Lake, and I spent my whole education basically in Ontario. I did my Bachelor of Science um, at the University of Guelph, and I majored in biomedical sciences. I did my Doctor of Chiropractic at the Canadian School of Chiropractors in Toronto. Then I moved to the island here where I did my 2-year part-time holistic nutrition diploma with the Canadian School of Natural Nutrition. So now I have a chiropractic practice out of a multidisciplinary clinic. I work with acupuncturists, physiotherapists, and I mostly see a lot of women. I have a family practice, so I see males as well, but the bulk of my practice is female. And in my sessions, we discuss anatomy and physiology, and it always comes back to female hormones and balancing those hormones and how that's important for our overall health. So people get a little mix of chiro and nutrition.
Very interesting. I actually just recently did an episode. It's not even published yet, but it will be by the time this episode is out. It's with a Dr. Wendy Sellens, and she's all about how all these different common foods like flax and soy uh, increase our estrogen, basically, and how that's
Hmm.
a big contributor to everything. Where do you stand on this? What's up with the hormone situation? It's a big problem.
It is a big problem, and I think we're just uneducated about our physiology. That's what it comes down to, right? I think when it's laid out, it's pretty simple, but I mean, I went to, I got a degree and then I went to chiropractic college, which is essentially a medical degree. We go through a bunch of courses, including immunology, physiology, women's health, and all that stuff. I still walked out thinking that birth control was going to be the best option for my body at that time.
Wow.
So, yeah. And so it took me a little bit to figure out that journey and to learn those things. And it wasn't blatantly clear with the education that we get at Western institutions, right?
So what did they teach you, and how does that differ from
Hmm.
what you believe now?
Well, I guess if I think back to my undergrad, it was very generalized, very Western medicine based of just learning the basics physiology. But I mean, when we did sexual reproduction as a topic in physiology, I don't think it's very stressed that, women can only really get pregnant in a 5 or 7 day window of fertility. That's not stressed to us, right? So it took me kind of going through my own journey that started with the holistic nutrition degree to then kind of close and fill the gaps of that female reproductive cycle that kind of was not super important at the time. Right. So I think every level of education you get a little bit and then you build and build and build. But my brain, I like mechanisms. I like to know why things happen for specific reasons so I can understand the bigger picture. So I think that's what was missing in terms of completing that picture for me at that period of time.
A lot of women, by the way, I think we should say you said island earlier. You moved to the island. That
Oh,
means
yes,
that means Vancouver Island,
Vancouver Island.
and that's where you're located now.
Hmm.
So there's a lot of women, young and old, that are put on the birth control pill to regulate their menstruation. So was that still taught to you in this holistic world?
Not in the holistic world, no. When I did my degree in holistic nutrition, they were very much for natural fertility awareness methods. They didn't teach us the whole gamut of it, so we didn't get a thorough education on it, but we touched upon it. And then if that piqued your interest, you can, self-investigation. But when you read stuff, when you do some research, let's just talk about PCOS, right? The way to manage that, birth control pills, right? And if you talk to a family doctor or um, someone in the Western stream of medicine, the first treatment is usually birth control pills to quote unquote normalize a cycle, right? And we're not really taught what a normal cycle is or what could fall within range of a normal cycle. That, I didn't know. I thought my normal cycle was normal because it was normal to me, but my cycle used to be almost 50 days long,
Wow.
right? So that was 50 days between period bleeds. And I thought, oh, that's just what I've always experienced. So that must be normal. That's not, right? So just using myself as an example, going from having about 50-day average cycles, now when I chart, I actually am healthier on my chart papers than I have ever been. And I have gotten my cycles down to the regular, what we're supposed to be in range, 28 to 29 days, or anything under 30 days is normal.
Like the moon cycles.
Like the moon cycles, yes.
So I've read a whole stack of books now on PCOS and
Yeah.
endometriosis, and some of them it kind of jumbles together in my head the two
Hmm.
different syndromes. I pretty much see them as the same kind of basic thing. Maybe we can get into that too. Like
Yeah.
PCOS stands for polycystic ovary syndrome, but you don't even actually have to have cysts on the ovaries to be
Yes.
diagnosed with it. So it gets a little bit fumbled. I usually just call them
Hmm.
female problems. But am I correct in thinking that the reason they prescribe birth control is because it tricks your body into thinking it's pregnant, basically, and when you have more pregnancies, statistically, you're less likely to get PCOS or endometriosis. I can't remember which one or if it's both.
Not necessarily. So the birth control pill, or if we want to extrapolate that and use a word such as hormonal contraceptives, right? So that includes IUDs that are hormonal, that includes NuvaRing or subdermal skin depots of hormones, because there's a bunch of things. There's patches, there's injections you can get. So if we just blanket term it as hormonal contraceptives, which includes a birth control pill, what they do is they are a dose of an exogenous source of estrogen to the body, which ultimately shuts down the body's natural reproductive cycle. So because we're getting an exogenous source, our brain, specifically our hypothalamus in our brain, is not required to signal to the pituitary to release some of these hormones because they're already there. So when we look at, let's say, for example, people on hormonal contraceptives, they're actually not ovulating because that cycle shut down. So if we compare them to someone who's experiencing menopause, their hormonal and serum blood hormone levels actually look very similar to someone who's in menopause. So we are shutting down the reproductive cycle with hormonal contraceptives. And that's why they look normal, because there was actually no reason to elicit a bleed on day 28. They just did that so women did not believe they were pregnant because it felt unnatural for women to go X amount of months without having that bleed. Does that make sense?
So how is that related to PCOS or endometriosis?
So that is related in a way that if someone presents with disturbed hormones, that could result in endometriosis or irregular cycles, such as we see in PCOS. The first line that the doctors may choose is to put someone on birth control to make their cycles appear regular when we're actually just shutting it down.
Okay. Do you think it has anything to do with the nutrient deficiencies that are also caused by the birth control, like magnesium, zinc, vitamin
Hmm.
B1, thiamine, B2, riboflavin, pyridoxine, and
Yeah,
a
so
bunch more, folic acid, all lowered.
a lot of it's lowered. It really depletes the body. So that's a separate issue because we have ovulation shutting down with those hormonal contraceptives. A side effect of the hormonal contraceptives are actually nutrient depletion. So that's where, because we're getting exogenous hormones, think about the liver's capacity to filter and detoxify those compounds. So we're putting stress on the body, and that's depleting the minerals and nutrients. My favorite one to talk about is actually B6, because a lot of women who go on hormonal contraceptives for the first time experience change with moods, or mood disorders. For example, if someone is relatively stable with their mood and they go on a birth control pill or hormonal contraceptives, they might actually experience increase in anxiety or depression if they are not getting adequate vitamin B6 through their diet, as well as seeing a depletion because of the pill. And the mechanism there, just because I love to nerd out and know the science, is B6 is very tightly related to the metabolism of tryptophan. And tryptophan is an amino acid that is responsible, and it's in the cycle to make serotonin, our feel-good hormone. So when we have a depletion of B6, we actually see lower serotonin levels, and we can have mood disorders and mood changes with that.
Yeah, that comes up a lot. Pyridoxine B6 being
Yeah,
one of the major deficiencies
yeah,
insinuated in depression for sure.
yeah, yeah. So a lot of it is, mental health related too. I mean, there's a bunch of resources. There's a bunch of books that I love, and the one book that was a really good resource that I read front to back in nutrition school was Nutrition for Mental Health. And though they
Michael
don't touch,
Lesser, yeah, or Carl Pfeiffer.
um, it's right here. I don't know who the author is. Let me grab it. It's right here. No, this one's Corn.
Okay.
It's a great one. It's nutrition essentials for mental health. And it is a wonderful resource. I don't recall, I read this a couple years ago now, but I don't recall them talking about hormonal contraceptives in here. But they do talk about all the nutrient deficiencies and how they relate to mental health. And I think that's an important read if you want to nerd out on a textbook.
I wrote it down. I
hmm
love the stuff as well.
Yeah.
So maybe we've gotten a little bit too specific without painting a broader picture
Yeah.
first. How widespread is hormonal problems, and what do you think
Mhm.
the major factors affecting it in today's women is?
I think a lot of women struggle with their health. I think we're quick to blame other things. But at the end of the day, I think it always comes back to hormone balance for us because our hormones are so intricate but also elaborate, especially because we, unlike men, have this amazing monthly cycle. And that if we don't understand it and we're trying to improve our health, we could run into problems and deplete ourselves without knowing it, right? So I think it's really widespread. I think at the end of the day, if we're talking about gut issues, we're talking about hormones. If we're talking about cycle issues, we're talking about hormones. Blood sugar issues, that relates back to hormones, specifically with PCOS. So like we can start unpacking that a little bit if you want to, because the main problem with PCOS is the heart of it is actually a metabolic disturbance.
Oh, I agree with you big time there. And almost
Yeah,
all of the books that I read, both by regular mainstream doctors and naturopaths and PhDs, they pretty
yeah,
much all agree that insulin resistance or a blood sugar problem, I would just call it a blood sugar problem,
yeah,
is
yeah.
at the heart of the PCOS thing. So what
hmm
is PCOS then? If it's
Right.
it's not
Yeah.
even just cysts on the ovaries, that's just part of it.
Yeah. So PCOS is a syndrome. Basically, it's a metabolic syndrome. And for someone to be diagnosed with PCOS, the gold standard is to use the Rotterdam criteria. So the Rotterdam criteria is basically three things. We have to see polycystic ovaries on a woman. We see oligoamenorrhea, which is either disturbed cycles or not cycling. And then we see the hyperandrogenism. So that's the Rotterdam criteria. And you need two of the three. So it makes it so that you can have different presentations and different phenotypes of PCOS. So we can go through the phenotypes if you want.
Yeah, I just want to
Yeah,
explain. Most of our audience here is pretty knowledgeable about health, but
yeah.
a lot of them will be on the introduction level. So,
hmm
androgen is male hormone. So, this is part of
Yes.
the PCOS syndrome where women can start getting like mustaches and facial hair and
Yeah.
hair where men would get it, they wouldn't get it. I don't know how to pronounce that word. Hirsutism.
Hirsutism. Yeah,
Hirsutism.
hirsutism. Yeah,
Hirsutism.
and so that could present as, male hair growth. So we see more wiry, dense hairs on the jawline. We might see actually chest hairs or chest around the nipples, very similar to men. That could also present as male hair loss patterning as well. We call that androgenic alopecia when we start to see the hairline recede here. And the acne that presents with that type of increase in androgens or testosterones is the acne that is really severe on the face or on the back that does not quite respond to antibiotics because it's a hormonal issue and not a bacterial issue. And then if we want to get a little bit more specific with the cysts on the ovaries too, um, for an actual diagnosis, if they're looking at your cysts, we require like a transvaginal ultrasound that can read up to 6 megahertz because we actually need to properly measure the cysts for size. So to have that polycystic categorization, I think the criteria is up to 12 cysts per ovaries, measuring 2 to 9 millimeters, or an increased ovarian volume, right? So it's not just enough to do a regular ultrasound or a transvaginal ultrasound without measuring it, because a lot of people have cysts on their ovaries and they might not have PCOS.
The cysts themselves aren't actually a problem. They're not a functional problem, right? It's just a symptom.
They're a symptom. Yeah, they're related to the body's inability to convert those higher levels of testosterone and the androgens to estrogen because there is an increase in insulin and glucose in the bloodstream. So that's where that little bit of physiology gets messed up.
So clearly one of the things that we have to work on is the blood sugar
The blood sugar is a
first and
big
foremost.
thing.
And
Yeah.
P.S., I did write a whole book about blood sugar. And by the way, Ashley Burton and I, Dr. Ashley Burton and I, don't actually know that much about each other. It was your
Oh
husband
yeah.
that pointed me in your direction. So I don't expect you to know my whole history or anything either. But
Yeah.
yeah, I have a whole book about blood sugar. It's one of the most common problems that are out there, but it's often part of the syndrome, as you said, metabolic
Hmm.
syndrome.
Hmm.
So
Hmm.
blood sugar doesn't really stand on its own. It's more of a foundational problem because people with this metabolic syndrome are super likely to have blood pressure problems,
Hmm.
blood fat problems, and yeah, these hormone problems, and especially PCOS.
Yeah, but what's interesting about the PCS criteria is that the criteria don't actually include that blood sugar problem. So BMI is not an important factor in diagnosing PCOS because we can have lean people have PCOS. The blood sugar, that's not actually a criteria, right? So the
Even though
criteria,
you are way more likely to have it if you are overweight.
yes, yes. Oh, sorry, PCOS.
Yeah, correct.
So that's like the stigma of it. So people can have PCOS and they could be lean individuals, just like we can have blood sugar problems if we're lean individuals, right?
Yeah, I agree. It's just that
Yeah.
we see it more often in overweight women, but we've
We
seen
see it
it.
more often in overweight women, and I think medical doctors are hesitant to diagnose a lean woman with PCOS because they're expecting them to present overweight and obese.
Oh, they're not even looking for it then.
Yeah. Yeah.
They could slip through. Okay.
Yeah. So they can slip through. Yeah, I'll let you go on. I was gonna go on off a tangent, but
Well, there's quite a lot of things to get into
hmm.
here. And I also noticed on your Instagram that you're against seed oils, yeah? So how does that play
Mm.
into this?
Yeah. So, I mean, if we go down and we think that, well, like you said, PCOS and like endometriosis, if we want to tag along any other, I would even like tag fibroids onto this category
Yep.
of there being a lot of inflammation in those conditions. And we look at seed oils, what do? They light up that inflammation really good, right? They are an excellent source of omega-6, and omega-6 is skyrocketed compared to what we get in omega 3s. And when we see an imbalance in the ratio, we have increased inflammation. That increased inflammation is what's basically at the heart of all those conditions, right? So we really want to steer away from those seed oils, which are super processed, stripped of their nutrients, and don't do any good in our bodies.
And they're oxidized.
And they're oxidized.
You can practically
Absolutely.
guarantee that they're oxidized. So let's explain this too, because a lot of people will know this, a lot of
Yeah.
people won't. The reason that a lot of people are against the seed oils from the beginning, I think it's been a confusion. People have been talking about PUFAs for a long time and stuff. And
Mm-hmm.
if you read between the lines, what seems to me to be the real problem is that these oils are easily oxidized, so they're rancid. So they're no now they're a free radical. Now you need antioxidants to clean them up instead of them being any sort of a nutritional source. That's
Mm-hmm.
problem number one. Problem number two, as you said, we consume so much more omega-6 now than ever before. So our ratio of 3 to 6 is way off. Pretty much everybody agrees that 1 to 1 is the optimal ratio. Only a
Mm-hmm.
very, very slight disagreement in there. It doesn't vary very much. So 1 to 1 is what we're supposed to have. Meanwhile, what we're currently getting is closer to 10 to 1 or 20 to 1 in favor of 6. So all the meats and the eggs and even a lot of good food, like real food out there, it just happens to be high in omega-6.
Yeah,
Only plants.
you have to make a real effort to get that omega-3 higher these days.
It's really, really not difficult. And then you add to the complication, there's several different forms of omega-6 and 3. Both of
Mm-hmm.
them are essential, but you've got people saying that things like flax can be your best source of omega-3. Like, don't worry, just eat all the
Mm,
flax, but you're not going to get hardly any, if any at all, EPA, DHA. Don't worry, if audience, if you don't know what these things are. There's a bunch of them. Like I said, it's difficult to remember even for me, ALA and GLA and linolenic and linoleic, and there's a
mm-hmm.
lot of these different acids that are all just called 6 or 3. But 3, to me, the really, really important ones are the EPA DHA, which is
Mm-hmm.
primarily from marine sources. It's plants that make omega-3, and the animals that eat the plants are high in the omega-3. But if we feed our animals corn and soy and wheat and oats, then they're hardly getting any of these omega-3s. So therefore, our whole food supply is practically tilted towards the omega-6s. So you think this is a big part of the problem?
I don't think it helps, especially when part of the recommendations for PCOS and inflammatory conditions is to eat more whole foods, steer clear of ultra processed foods that have been stripped of their minerals and nutrients and packed with sugar and fats. Oh, sorry, my dog. And fats that don't actually help our bodies, right?
It makes sense to me. And
Mm-hmm. Mm-hmm.
just by the way, too, people say that omega-6s are inflammatory. It's kind of true, except that they're essential at the same time. But it seems that they're really
Yeah,
only
it's
inflammatory when that ratio is off, when you don't have
yeah,
enough
it's
omega-3.
the dose is the poison, right? That's what I like to say with that.
Yeah, okay, and the imbalance, and that has a lot to
Yeah.
do with blood sugar and stuff as well. I mean, these are
Yep.
key nutrients. We need a lot of the omegas.
Mm-hmm. Mm-hmm.
It's not micrograms here; it's grams. Okay, and so the insulin resistance. Do you consider this part of the same basic problem? What do you do basically? Somebody comes into you with PCOS. What's your program?
What's my program? Well, I think it depends on where they're starting from. So, I mean, I have patients in my practice who have PCOS who are on hormonal contraceptives to regulate their cycle outside of when they're trying to conceive. And it can be hard to conceive because with all the inflammation and with the insulin resistance, we see delayed ovulation because it's playing with the hormones. It's actually changing the ratio of luteinizing hormone, which stimulates ovulation, and follicle stimulating hormone, which helps the egg grow in the ovary and release the egg so that there is ovulation is possible. And then if they do conceive, sometimes they actually need help to conceive. There's medications that can actually trigger ovulation instead of trying to figure out or trying to guess when you're ovulating. And that is once you've conceived, sometimes those individuals have a hard time getting along and they actually have a higher risk of miscarriage because of those hormonal imbalances.
So, because infertility is one of the symptoms
Hmm.
of PCOS, one of the things that comes along with PCOS, a lot of people try and force their pregnancy. That's kind of what you're saying?
Not force their pregnancies, but they can seek medical treatment for that. So some people will do IVF, some people, um, there are a couple different medications that you can use, typically Clomid or Femera. The Femara is the fancy name. It's actually letrozole, and individuals will take that to trigger inflammation so they can plan their conception, so they can plan to have sex around the time where an egg is released. Otherwise, with PCOS, when we're trying to look at someone's cycle, whether we're tracking that naturally with fertility monitoring, which we can get into, or if we're using ovulatory predictor kits, which is like a little urine dipstick that you can pee on and put into a little machine, and it tells you if you're about to ovulate. It can be hard to time sex properly for conception. And if you're the type of person with PCOS that will go so many, like we can go up to like 90 days without a cycle, then you're waiting 90 days to try to conceive again. So those medications like Clomid and Letrozole, they trigger ovulation by tripping the signal to your brain to release an egg, and then that's your opportunity. But if your other hormones are not orchestrated and to support that pregnancy, then there's an increased risk of miscarriage there.
Well, that makes sense to me too, because you haven't actually
Hmm.
fixed the underlying problem. Clearly, there's still a
No.
metabolic problem going on.
Yeah, there was a fun analogy about it. Like think about a tap, like a sink tap, and you're turning on water. So if, let's say, birth control pills just close the tap because it's shutting down our ovulation, when we take the birth control away, we're still going to have a flood, right? If the tap is broken.
Hmm.
And same way as if we close that tap with birth control and then we try to turn it on with Clomid or letrozole, once that flood starts or once we ovulate, we're still going to have a flood of issues that we're not dealt with.
And
So,
she's still likely got inflammation herself.
yeah, there'll still be inflammation in the body for sure, right? Um, Whenever we try to modify our physiology by medical means or by, not natural means and following the body's cycles, there's going to be some repercussions. And that is usually hormonal insufficiency from nutrient depletion. And then, unfortunately, the side effect of also not figuring that out is inability to carry a conception to term.
And by the way, in animals and in humans, you could have a miscarriage from numerous nutrient
Hmm.
deficiencies, even a
Hmm.
few of those that were already mentioned that are depleted directly by birth control. So you I asked you what you do, and you said it depends on the person, and that's a great
Oh,
answer.
yeah.
It always depends on the person.
Yeah.
So a woman comes into you who's on birth control. Does that prevent you from getting her normal? Will that hold her back fundamentally, or can you work around it?
Getting her, well, so she's not actually cycling naturally on a hormonal contraceptive. So if the goal is to cycle naturally, then she has to come off of it. And the first thing I do when we talk about this, so I'm actually in the middle of designing packages to offer clients right now. And the packages are one of three things. It's a preconception fertility boost to get ready to have a baby, and then a postpartum kind of rebuild to sustain breast milk production and weight and fitness, and then a post pill fertility reset, which is important for anyone first coming off hormonal contraceptives because the minute we come off the hormonal contraceptives, if the goal is to achieve pregnancy, I don't suggest trying to get pregnant immediately because we need to replenish and fix those mineral and nutrient imbalances before we try to conceive to make sure that our stores are good so we have a good foundation to build a baby.
Yeah, good call. Your husband said that we would agree on a lot, so
Yeah, yeah, yeah,
we're on the same page here. What's in
yeah.
those packages? What are they nutrients or herbs?
Oh, sorry, like packaging that I would offer as coaching, right? So
Okay.
it is like nutritional consultation, but the main thing that I love doing is teaching women how to chart their cycles naturally to collect all this data that our body gives us and then interpret that and use that to see, is my cycle normal? How can I get it normal? To help with identifying ovulation and our fertile window to make conception easier, to make preventing conception easier, but also to use it as a tool for our overall well, for our overall health and wellness. Um, so for example, when we chart, there's three there's like four things we're looking for. So um, I'm looking for basal body temperature. So
Nice.
that's one of the signs that we check, which is a really great indicator of our metabolism and thyroid health and what part of the cycle that we're in. We observe for cervical mucus, right, which will tell us which window is our most fertile window if we're able to identify and differentiate the different types of cervical mucus that our cervix produces. The third thing we look at is cervical position, which the cervix, which is the very tip and bottom of our uterus, actually moves and rotates a little bit depending on what part of our cycle we're in. So by looking at those three signs and other signs, those three mainly, we can actually interpret them to identify our fertile window when we've ovulated. And then the period after we ovulate, it'll show us our non-fertile cycle, which things happen in that part of the cycle that really blow my mind. Mostly just the sustained increase in metabolism from the increase in progesterone, which is super important for us as women. And that's why it's important that we understand that that cycle separates us metabolically from men. And sometimes even the recommendations for weight loss, nutrition, even weight gain becomes more challenging because of the increase in metabolism we see in the last half of our cycle.
Increase in metabolism. So
Yes.
what do you mean by that? Why does that change for men and women? What kind of things impact it differently?
Yeah, so just we'll go through like the female cycle a little bit. So we have two phases, right? We have our follicular phase, which is the phase where our follicle is growing an egg to be released for ovulation. In that period of our cycle, estrogen increases and increases to let that egg grow. Once estrogen peaks, we have a signal from our hypothalamus. It releases luteinizing hormone. That is a sign for us or our egg to be released. And that event of releasing an egg is ovulation. Now, the thing that we might not know is that the egg is actually only viable for 12 to 24 hours. And if it gets fertilized, then we can have a possible conception. But if it doesn't, that egg just gets reabsorbed. So our egg's only viable for 12 to 24 hours. But in that follicular phase, in the period where that estrogen is going up, that's where we also start to see cervical mucus. The cool thing about cervical mucus is that it actually has a lot of nutrients and minerals that keep sperm alive for 5 days. So if you were having sex on the cervical mucus days, let's say day one, that opens our peak fertility window. So actually we can get pregnant the minute we start seeing cervical mucus to the 24 hours after that egg becomes obsolete. So our fertility window is usually 5 to 7 days, depending on when a woman will see their cervical mucus. So ovulation happens. Once the egg is released, then we see an increase in progesterone. What lets us know we've ovulated is when we can see an increase in that basal body temperature. Progesterone increases our metabolism, and that increase in metabolism, seen through that sustained basal body temperature, lasts until we have another period or lasts until a baby's born if we've conceived a baby. So why that's important between men and women is because let's say I'm just going to use my example. My husband and I, we lift weights. We're both in a weight gain phase right now, trying to put on muscle because the more muscle mass we have, the healthier we are, the stronger our bone are, right? The stronger our bones are. So when he's gaining weight, his maintenance calories don't change. When I'm trying to gain weight, my maintenance calories change after I ovulate because my metabolic rate has gone higher. So the minimum amount of calories I need to sustain my weight gets higher. And if I'm trying to eat at a certain calorie range, I actually need to go above that to gain weight that week. Does that make sense?
That's interesting. I've never heard that before.
Yeah. And so where we get into problems with that, especially stress problems with women, is when women are trying to lose weight and their calories are low, and we see that bump in metabolism and our calories are still down here, there is this big lack of food and an increase in cortisol because our body's stressed because it's not getting the nutrients it needs.
So that increase in cortisol is also going to increase insulin,
You got it.
which is inflammatory.
Yeah. And
And
then women might start seeing that they're not losing weight because their cortisol is so high because they're not meeting their basic metabolic needs.
got it. Okay.
Yeah,
And
yeah.
this is part of the same metabolic syndrome too, right? They call it hyperinsulinemia. Lots of
Yeah,
insulin.
high blood sugar. Yeah. Yeah, high blood sugar or being resistant to insulin, same thing, right? When the body does not reabsorb um, the glucose because our cells stop responding to insulin.
Okay, I've got a question a step back, just
Mm-hmm.
one step back from where we're at right now. To the question of, I asked if a woman's on birth control, can you still help her?
Mm-hmm.
I guess my new question is, do you need to cycle correctly in order to reverse this metabolic syndrome? Can they, like, say this woman, she doesn't want to get pregnant and she just wants to get rid of the acne
Mm-hmm.
and maybe the mustache and maybe period pains or whatever. Can you work around birth control, or is it just going to fundamentally impede her progress, whether she wants to get pregnant or not, or have regular cycles or not? Say that's not one of her concerns. Should it be?
Like if she's on birth control, it should be. So the birth control would actually mask some of those symptoms of the acne and the hirsutism because it's giving the body a dose of estrogen, right? So with PCOS, those symptoms present because the body can't take that excess testosterone and convert it to estrogen. So that's why we see those male hair growth patterns and the acne. Um, so let's say someone's goal is to conceive and they don't want those symptoms, then we still have to get her off birth control to be able to ovulate on her own. And to control those symptoms, we would make sure that we have a period of time where we work on rebalancing her hormones and getting her looking healthy on her charts. So that is the fertility awareness charts where we chart our cycle signs. Once she's looking healthy there, then we would go and try to conceive.
But what if she doesn't want to conceive? Can
It's just
anyone get healthy with being
Oh
on birth
yeah. Oh
control?
yeah. So like I chart my cycle. I've been charting my cycle for 3 years now, and my goal is not to conceive right now, right? So I still chart every day. I still collect my data because it lets me know when we can have sex without making a baby, and lets me know if I look healthy on paper or not, right? Which is really important, and especially it's data that we can collect ourselves and not have to go seek medical care to do that. All you need is a thermometer and make sure you have time to check your fertile signs,
If
which
the
is awesome.
woman is willing to get off the birth control, what do
Hmm
you do now? What's your coach? What's your advice?
Advice is if she's okay tracking her cycles, we track her cycles and then we replenish her nutrients. So we put her on a fertility reset diet, basically, which we're going to, there's like four major things. If we're talking about PCOS specifically, that's going to be our foundation for supplemental support if we're not able to get it through whole foods. My first option is obviously eating a whole foods diet rich in animal foods because that's where we're going to get our cholesterol to build our hormones, right? We don't see cholesterol in in plants. So really healthy animal fats and proteins, lots of fish and cold water small fish for our omega-3s. And then we're going to reboot with all of those minerals that we've been depleted from. So we're thinking lots of fresh veg, lots of healthy fats, especially fats that contain our fat soluble vitamins. So I'm a huge fan of grass-fed butter because we get our vitamin A, D, K, and E, right? Fats that are found on grass-fed animals is an excellent source of that as well. And organ meats. I'm always pushing organ meats because that is going to be the biggest bang for your buck in replenishing all of the nutrients that were depleted by the birth control pill.
Best
There's
deal in the grocery store.
best deal ever. So we're seeing iron, we're seeing B12. selenium, iodine even, right? Which when we're working with women, we're for the fertility, we're concerned about the thyroid and iodine. So that's super important. I mean, I get super excited about talking about bone broth because of this topic. So we do organ meats in my house weekly, bone broth weekly, right? Not only just for optimizing fertility so I can have an optimal cycle where I don't have any pain and I have a normal cycle, but also just for muscle repair because we're big on working out and getting stronger, for healthy skin, for healthy gut, right? So fundamental diet first. And then with PCOS, um, nutritional supplementation, we can actually recommend like a prenatal vitamin because we're going to cover our basis, right? Prenatal can be taken even if you're not trying to conceive, just trying to replenish the vitamins and minerals that we were lacking because of the hormonal contraceptives, because they're going to optimize fertility, right? Optimal fertility is optimal healthy periods. And then if we want to go a step beyond that, my recommendations for supplements are going to be vitamin D with K2, magnesium, NAC, and then if the woman has PCOS, inositol. So those are the foundation.
What kind of doses are you using? Mega doses or just normal replenishment
Um,
doses?
so vitamin D, I mean, 4,000 international units, right? So usually we get like what, 1,000 off of one little tablet.
Mhm.
I don't know what supplements. You have your own supplement company, don't you?
Well, I distribute for one,
Oh,
but
okay.
yeah, in Canada, most of the vitamin D supplements are limited to 1,000 IU per
Yes.
serving. It's
Yes, they
it's
are.
pretty annoying actually. In
It's
America,
low.
in America, we get 510, no problem.
Yeah, that's amazing. So, for example, the brand that we have in the house is CanPrev, and the dose is 1,000 international units, right? So, I mean, I'd have to take four of those to get the dose that I want. So, about 4,000 for the vitamin D3, K2, magnesium, 500 mgs, NAC between like 12 and 1,600, and I think NAC is only the NAC I have is not that high, so I'd have to take a couple to reach that. And then the inositol is awesome because it actually acts similar to metformin, which is one of the medications first in line for PCOS to help with blood sugar regulation. Um, Inositol acts as a direct insulin modulator. So instead of attaching to the cell receptor, it actually goes into the cell membrane and will affect um, the cell machinery to have an effect to let more glucose into the cell, where metformin kind of does the same thing, but inositol is just an overall more holistic option. And that dosage usually is 4 to 6 grams per day. And we see similar results to metformin.
That sounds like a huge dose to me.
Yeah, yeah. I don't know what that looks like in terms of the way it's administered. Like I'm thinking inositol is a powder. I have never used it myself personally. The other three I use daily.
Okay, so your patients use this inositol though?
Not right now. No, this is just something I've been looking into.
Okay, because I was gonna say that sounds like an
It's a
enormous
big
dose to
dose.
me.
Yeah.
Inositol is a little bit interesting. It's a B vitamin,
Yeah.
and it is essential. But I've seen some people kind of argue that we shouldn't even keep it in the list of essential nutrients because it's so abundant in foods. I'm
Yeah.
not saying I don't agree with this. I know it is abundant. It's in almost all food, but still, I'm seeing now recently some people talking about using much higher doses.
Hmm.
So that one's interesting to me.
Yeah. That was like the just the foundation of, and that actually comes from. I love this book too. This is new. Real Foods for Fertility. So this is by Lily Nichols and Lisa Henderson Jack. They both have their own separate books, which are super amazing if anyone wants to dive deeper into nutrition and fertility. Lisa's book is called The Fifth Vital Sign, and that is basically how I learned to track my cycle. She's amazing. And then Lily Nichols has her book, she has two. She has Real Food for Pregnancy, as well as Real Food for Gestational Diabetes. Again, blood sugar regulation. She talks about whole foods, balancing our hormones, making sure we're not spiking our blood sugar too high with simple carbohydrates, and her recommendations, as well as Lisa's, are to consume organ meat to replenish and prepare for pregnancy. So it's a vital, vital step in taking that direction.
Okay, I've got a bunch more questions along these
Hmm.
lines, but first, I think this is a good opportunity for me to slip in just a little advertisement here. Most of the listeners will be from America, and good news is for you, America has thriftbooks.com, which is the best bookstore in the world as far as I'm concerned. I buy almost all of my books off of thriftbooks.com, and as soon as we get done here, I am actually going to look up the books that you talked about
Hmm.
and see if they're there, and honestly, they probably will be. Thriftbooks.com has a huge, huge inventory. I buy a lot of older and obscure books, and I usually find them. Most of the time, I find them, and most of the time, they're an excellent deal, way better price than anywhere else. You also get free shipping in America if your order is $15 or more. I find that a fantastic deal. You also get points, so you get free books periodically. I get free books on practically every other order, every third order or something like that. I get a free book. Can't say enough good things about thriftbooks.com. And I don't have a discount link for you because they already have the best prices on the market. But if you are in America, you want to use thriftbooks.com and you want to help me out a little bit at the same time, you can use my link in the description where I will get a very small commission if you do buy books there. But I recommend it. I use it. If the book's not on thriftbooks.com, I usually wait until it is because I can't beat those prices anywhere. And unfortunately, Ashley, it's not the same for us in Canada. The shipping
I
fee,
know.
it kind of negates it. It kind
There
of
was another
negates it.
one. There was a, I forget the name of it. There is another one for Canadians though. I I'll have to get back to you because I've got to stop buying books because first I'm running out of space and second it just gets expensive. So yeah, I'll link that to you so you can put it in the show notes for the Canadians because there is a place to get cheaper books in Canada.
I hope so. I would
Yeah.
I would like to know that. Okay, you mentioned grass fed. You're all about the grass
Hmm.
fed, and now I agree grass fed is better overall, but could you tell us why does grain fed butter have less vitamin D, E, A, and K in it?
I would probably argue yes, right? Because we have to think about those, let's say, conventionally raised cows are being fed corn. So they're going to have higher inflammatory profiles just as their own beings, right? They're not going to get the same nutrients and minerals that we get from the earth, from grass, from sunlight making that grass, right? And so what's interesting about the grass-fed cows is that if the farming practices are um, excellent, they'll actually move their herds from pasture to pasture so that there is replenishing of the nutrient stores in that pasture as well. Whereas conventional cows, they will just be penned up in one area. They're not going to see a whole lot of sunshine or fresh grass that has been remineralized. And they're just going to be fed the same basic grain that's very high inflammation. They're going to get lots of corn and soy, which just jacks up their omega-3s. And then we turn around and eat that. They also may be pumped with hormones because they're not in their natural environment. They might be crammed in. They might have more sickness with that. So we're getting a dose of hormones from our meat if we're not careful where we source our meat from. And the quality of minerals and vitamins in their fat is going to be less, right? So if we took conventionally raised meat, let's say we took a sirloin steak and from a conventionally raised cow and a sirloin steak from a grass-fed cow, the marbling is going to be different, the color is going to be different, and if we did some biochemical analysis on them, the mineral and nutrient profiles will be different as well, right? So something might look the same on the outside, but the value that our body receives is going to be tremendously different.
I think you meant they're jacked up in omega sixes, those
Yes,
conventionally
yes,
raised.
sorry.
Yeah,
Yeah, if I said three.
one of those problems we already talked about.
Hmm.
But yeah, that is one of the problems with conventional meat is that it's very, very high in omega-6 and it's very high in fat too. And fat is good. We're all about good natural fat, but when the meat is way higher, the meat, the fat to protein ratio is thrown off. It makes it basically an unhealthy food.
Hmm.
All wild meats are much, much leaner including a cow. It's not meant to be a big fat animal like that, especially not with these big streams or veins of fat in. That's what we call marbling, right? It's not supposed to have that. Not supposed to be that pronounced. Same way as salmon, a wild caught salmon has these little thin lines of fat, veins of fat, but the farmed ones have much thicker. It's now no longer such a health food. Okay, I'm on board with that. Okay, so you're pretty passionate about cycling, keeping track of your cycles. So
Yes, yes.
I think you're kind of saying that the rhythm method here is the smarter form of birth control, at least if you want to be healthy.
That's funny that you say that. In the rhythm method, sometimes it lacks a little bit of information. I'm not fully convinced that it's super highly effective rate. I think the way that Lisa says it in her fifth vital sign is it's a joke. She's like, you know what we call people who use rhythm method? Parents.
Fair enough.
Because there is some trouble. So it's not rhythm method. It's not trying to predict. We're not trying to predict when ovulation is. So, I mean, if I am to go into it a bit, like I take my temperature every morning and I can tell when I'm getting closer to ovulation because my cervical mucus will change. I know to pay more attention to my basal body temperatures in the morning around that time. And basically, the rule in our house is when we're not trying to make a baby, we're not having sex until 3 days after my temperature has a sustained temperature for 3 days. Because then I have confirmed I've ovulated over here because I see the raise in temperature. So now it's certainly safe to have sex to prevent conception. Whereas there is no safe days in your fertile window, the time before you ovulate, because remember, sperm can stay viable in that cervical mucus for 5 days leading up to ovulation. So it's not predicting, it is making informed decisions based off the data that you collect from your body. And I feel 100% confident using this method of birth control after having done it for years and having healed my cycles and um, normalizing my cycles using the data I've collected and then obviously making the lifestyle changes.
So we should probably expand this a little bit because
Yeah.
10 years in this business, and I only recently heard this mucus thing like literally last week. I read it in a
Yeah.
book last week. I'd never heard about that, never thought about that. Maybe it's more well known in women's circles, but I had certainly
No,
never heard of that.
it's not. I talk to my patients about it and they are fascinated. Even some people jump off my chiropractic table when we talk about their cycles and I'm working on them and I say your cervix position changes, right? But how would we know that if we're not taught? And I mean, we don't check that unless you know what you're looking for.
Can you check that manually?
Yes. So how you check that is that you just go and feel up your vagina and your cervix is going to be the thing that you bump into when you reach up there. And depending on where it is, will give you a clue as to where you are in your cycle. So you obviously clean your hands. The best time to do this is in the shower so that you're clean, your hands are clean, you're not wearing clothes. You go up and you feel through your vagina what you hit first. Sometimes if you're early in your cycle, so if you're in your follicular phase, you have to go and search up there pretty high. So higher, sorry, if we're just coming off of our period, it'll be quite low. So non-fertile days are when the cervix is low and it's closed and it's hard. So it kind of feels um, kind of like the tip of your nose, like you're bumping into a nose up there.
Like the size of an acorn, right? Like a little ball.
Yeah, or like the size of your thumb, right?
Okay.
Let's say we're hitting something. So on non-fertile days, again, it'll be low, firm, and closed. Days that were closer to ovulation, it'll be higher, soft, and open. So I take my basal temperature, the cervical mucus, and cervical position, and then we can tell you where I am in my phase, if I'm on a fertile or non-fertile day, and then you can make your decision on, okay, am I going to have penetrative, unprotected sex to either conceive on that day or am I not? All right, so cervical mucus is a total different story. It's cool. Do you have any questions specifically about that?
Yeah, because the book that I read about it didn't give a lot of detail in it. So I'm thinking
Yeah.
like, well, what's the difference between so you have to reach inside. The mucus is coming from the cervix.
So the mucus comes from the cervix, but you don't have to reach inside. No. So reaching inside is only to feel and assess for your cervical position. The cervical mucus, it's a discharge. So it actually will show up on underwear or when you wipe after going to the bathroom. And so cervical mucus is a hydrogel made of water, different proteins and minerals and enzymes designed to keep the sperm alive for 5 days. It actually makes it so that your sperm can easily swim up to meet the egg because the egg gets fertilized in the fallopian tubes, right? And there's different kinds of cervical mucus. There is peak cervical mucus, which looks like almost like raw egg whites. It's very wet, stretchy. You can stretch it between your fingers. Um, so that is our peak mucus. That's usually what we see immediately a couple days before ovulation. And then we have the non-peak cervical mucus, which looks like a hand lotion. It's more creamy. It might lift between your fingers a little bit, but it's more so, um, let's say more viscous, right? It's thicker.
So when it's thicker like that, you're beyond ovulation and now it's
So
safe to try and have sex.
So when you see any of those two types of cervical mucus, that happens before ovulation. And both those types can get you pregnant if it comes in contact with the sperm.
So this is why people fail at the rhythm method because they're only avoiding sex on the days of ovulation or really, really close to it, but that mucus could have already been there and could have trapped sperm from days ago.
Yeah. Does that
Okay.
make sense?
Okay,
Because
so
that
after
first,
ovulation, there's no mucus there.
so once you ovulate, so everyone is going to be different. I'll use my cycle for an example because I'm very in tune with that. Um, my cervical mucus will start. It'll get that non-peak for like 1 or 2 days. Then I'll see peak mucus for about 5 days. I get that like super stretchy, wet stuff happening for 5 days. The day I ovulate, it actually dries up a little bit. So my temperature is up the day I ovulate. So I pay attention to that temperature and I see 1, 2, 3 high temps to confirm I've ovulated. After I ovulate, we're dry because we need estrogen to produce that cervical mucus. But when we ovulate, our estrogen drops and we see an increase in progesterone. So that progesterone makes it so that there's a cessation of production of the cervical mucus because it's waiting to see if there is an egg implanted to carry a pregnancy, right? So I don't know if we said any of this before, but when we ovulate, the egg gets ejected from the follicle and that area where the egg was ejected from becomes something called a corpus luteum, which actually produces estrogen. The amount of estrogen that corpus luteum makes determines the length of our luteal phase. And the stronger progesterone we have, the more likely the endometrial lining of the uterus can sustain a pregnancy. So basically, your question was cervical mucus, we see it before ovulation. We ovulate, we don't see it again because this is our infertile phase. We cannot get pregnant after you've ovulated once the egg is gone. Does that make sense?
It does to me, but I know a lot of
Hmm.
these terms took a long time for me
Yeah.
to sink in.
I know. We need a flow chart. We need some graphics.
So 3 days after you've confirmed ovulation, you consider that completely safe,
Yes.
for intercourse. How long before that? Like, are you avoiding it during the entire first phase, the follicular phase?
Some people might. So let's say I have a couple dry days. I think it depends on everyone's cycle because day one of your cycle is your first bleeding day. So it's your first day of your period. Some women might see cervical mucus right when they stop bleeding because if I'm not careful with my cycle and if I am over exercising or overstressed, I tend to have a delayed ovulation. So my ovulation happens a bit later in my cycle. So I do have dry days. It just depends on how comfortable you are with taking the risk of being able to decipher if you have non-peak cervical mucus or not. So the rule in my house is no unprotected sex in our follicular phase at all if we're not trying to conceive.
Fair enough. We use the
Hmm.
rhythm method too, and I'm gonna bug my wife to listen to this episode too because I
Yeah.
want to be a little bit more sure about that. As you said, people who practice the rhythm method, they tend to be parents, so I'm trying not to be. Okay, so all the books that I've ever read on the subject of women's health have really focused in on stress. And you already
Hmm.
mentioned cortisol earlier, and we already
Yes.
mentioned that when cortisol is released, the stress hormone, your blood sugar also increases. Part of the fight or flight response, right? You need extra blood sugar, more fuel in the engine so that you can fight or you can flight. So that can be one of the reasons for elevated glucose in the first place is chronic stress and other factors as well. I'm just saying that a lot of these books, all of them, zero in on stress. In fact, many people have called PCOS the working woman's disease.
Mm.
So, do you address this in your practice? Do any specific stress reduction strategies?
Yes. So the topic of stress is important to me. Just from personally trying to fix my cycles. My cycle issue was a stress issue. Um, so stress can affect us in a couple different ways, and we can categorize different types of stresses. And so the first one we probably think of is mental stress, right? Stressful situations, work, home stress, family stress. There's that kind of stress. There's other stress that we usually don't think about or consider, and that is um, that can be stress from overexercise. Okay, we see that with a lot of women
Hmm.
who want to get fit, want to lose weight, or who are overworking out, right? So we overdo that and we stress physically. We physically stress our bodies. Add to that the stress of maybe not consuming a balanced diet or maybe not even hitting or attaining enough calories to sustain our basal metabolic rate, right? So we have physical stress from overwork in terms of physical activity. We have stress from underfueling or having a poor diet, right? So not getting enough nutrients and minerals, being depleted, and then mental stress. And so those are important because they can actually lead to problems in our cycle, just different problems. I know we talked about PCOS, we mentioned endometriosis and fibroids, which stress certainly impacts those. Um, what I struggle with personally is a tendency to have a condition called hypothalamic amenorrhea. And that is a condition where our body is under those three types of stress that we spoke about, so much so that the body doesn't have enough resources to actually cycle because of all the stress. So it shuts down our cycle. So when I came off birth control, I actually didn't have a period for about 6 months. That's not normal. So I had to work really hard to get my period back, but I was underweight. I was over exercising. I was working full time and doing part-time school and going through relationship stress. So there's no wonder my body shut down ovulation because in a situation of fight or flight, the last thing your body is going to prioritize in terms of energy distribution is having a cycle. It'll prioritize blood sugar to your brain and your muscles so you can keep doing what you're doing, right? And it'll prioritize your organs. So it's going to prioritize your heart beating and your lungs bringing in and out of oxygen and eliminating waste from your body. So the body's so smart, right? And if it feels like it's running from a lion, it's not going to say, hey, you're looking really relaxed. We should put a baby in you.
For sure. Makes sense to me.
So that's something that I had to work really hard on is was fixing that tendency for me to have hypothalamic amenorrhea tendencies. And often
What does amenorrhea mean?
amenorrhea means no period. So
Okay.
amenorrhea is
Oh,
bleeding in the medical
amenorrhea.
amenorrhea.
Okay.
Yeah, so it's a lack of a period. So um, I mean, I didn't have a cycle for about 6 months. Then it finally came when I reduced my stress, but I was still working out too hard and under eating. So my cycles were delayed. So that's why my cycles were 50 days long, right? I was having less than 8 cycles a year because of that. And so I tried giving up exercise. I did yoga for a bit. Um, I was probably still under eating. Derek and I, my husband, he's still really big into the cold dips. So we were cold dipping a lot. We live on Vancouver Island where we can hop into an ocean or a lake or a river any time of the year for cold exposure. And I was doing that 3 times a week. And that's more stress on the body, especially my body that was already stressed. So I actually normalized my cycles just this past winter when I gave up cold dipping.
Interesting. A lot of people are
Yeah,
promoting it, but
I know.
it's mostly men though, yeah.
I know. And you know what's funny is that was the last thing I wanted to give up. I increased my calories, I stopped running, I stopped working out heavy, and I still had long cycles. And so I had two different naturopaths, not naturopaths, two different acupuncturists say, honey, you need to keep your little incubator warm, right? The womb needs to stay warm. And that's exactly what that increase in metabolism and our higher basal body temperature is trying to do for us in our luteal phase of our cycle. It's trying to keep our bodies warm. And the cold dipping was just too much stress. And so now my cycles are 28 days long. They're normal.
Well, cold dipping
And
is the exact opposite of relaxation.
it's the opposite of relaxation and it's the opposite of keeping your baby making organs warm, right? So, I mean, I might try to go back to it and only do cold dipping in my follicular phase where I'm more stress resilient, right? But that's something that I don't want to mess around with right now because my focus is somewhere else and I am healthy on my paper charts right now. So,
Well, I'm good without the cold dipping too. Um, okay, you talked about the hypothalamus.
yes.
I think we should just kind of explain that this is also something that always comes up in women's books. There's this thing called the HPA, the hypothalamus pituitary axis. My question for you
Yeah.
is, well, I guess to the audience, that those organs, the hypothalamus, it's a part of the brain on the bottom of the brain, and then your pituitary gland, which is usually called the master gland behind your eyes. Both of those are like they're in your brain basically. They tell your other glands lower down, like your thyroid, what to do basically. So they can affect the way that your other organs express hormones. So my question here is, what did the stress have to do with the HPA? Did it shut it down? Did it cause it to produce too
Mm.
much of something or
Yes, good question. So there's a couple different axes that we have. So you said the HPA. So the HPA axis is the hypothalamic pituitary adrenal axis. So that's one that people usually refer to. There's also the hypothalamic um, pituitary ovarian axis, and that's what's important for women, right? So we have the hypothalamus, which releases hormones to affect the pituitary. The pituitary then relates a hormone message to the ovaries. So that is the cycle that can get disrupted in women with stress. And so ultimately, with PCOS, as well as with the condition that we talked about, the hypothalamic amenorrhea or HA, we can call that for short. When we have stress, it signals the hypothalamus to actually shut down ovulation because our energy reserves need to go somewhere else. So that's similar to the way that insulin or high glucose levels signals the hypothalamus in PCOS to alter ovulation. So we either see delayed ovulation in PCOS or no ovulation in hypothalamic amenorrhea. So stress plays an important role because it actually shuts down those pathways to prioritize other functions. Because the HPA axis, the hypothalamic pituitary adrenal axis, controls many other hormones and organs in our bodies as well.
Could this also cause somebody to menstruate excessively? I know I have one case right now where she's bleeding more or less constantly, and it's just kind of a low
Yeah.
level constant bleed. Is this the same thing, or is this a completely different problem?
It could be related to the same thing. Yeah. So that could that picture could present as PCOS as well, or that could be an endometriosis issue. But when we have hormonal disturbances from stress, we could see either that condition, which is menorrhagia, excessive bleeding, or we could have oligomenorrhea, which was the one where we see longer cycles or no cycles, right? So altered cycles, basically. Stress is ultimately a huge component of all these conditions.
So it's the same root. It can cause
Yes.
excessive or lack.
Yes, you got it.
Okay, interesting. And so when you said there was a problem with the hypothalamus, you can't get around that by stimulating the pituitary, can you?
Um, so I mean, you could. And we talked about that a little bit with PCOS. So if someone with PCOS is trying to ovulate, that's where that Clomid or letrozole comes in because it triggers ovulation. So it signals the pituitary to release luteinizing hormone to release an egg for ovulation. So there are medical ways to get around it for sure, but the initial problem is still at the top of that food chain, right? So if the problem is coming from the top and we try fixing it by either manipulating physiology or putting a band-aid on physiology midway through, we're still going to have the problem once we remove that band-aid solution.
I got it. We gotta get off the
Yeah.
bad foods, people. We gotta get on more nutrients and avoid seed
And I,
oils and
yeah,
phytoestrogens.
yeah. And one thing too is I think it's not, I don't even think that's the first step. I think the first step is just to be educated, right? I think when I spoke about this on a different podcast, a lot of women were afraid to know what's going on in our bodies because then we have to take initiative, right? We have to own it. Once you know what's going on, you have to own it and you can't keep your head in the sand. So when we find those little bits of information from charting that says we need to change something, that's a big step is like, okay, do I want to change this? Do I want to put effort into changing this? Because that's motivation, right?
I
And
got you.
it's
Attitude, commitment.
empowerment.
Yeah.
Yeah, it's empowerment. And ultimately, charting your cycle and learning more about your cycle and yourself is a tool of empowerment to then make informed decisions where you can then choose, okay, instead of, for me, I was like, I'm not giving up weightlifting. And at one point I said I was not giving up cold dips, but I had to make an informed decision, right? Same with I wouldn't just throw someone on a gamut of supplements hoping something stuck. If we looked at her charts and we saw, okay, things are not right here, then let's try one strategy that's more effective than trying just to reduce overall stress, reduce, you can make more tailored recommendations if you know what someone's charts look like. That's why it's important to always seek medical advice and medical advice that's tailored to you. So I guess a midway, not a midway, but at the end, we'll do a health disclaimer right now. This is not medical advice for personal use, right? Always please seek advice from medical providers that you trust and who understand you and who are giving you information based off of your physiology.
It should be customized. Okay, so
Obviously, yeah.
women should definitely reduce their stress, and I'm just gonna throw it in there that deep breathing is gonna be one of the most
Mm.
effective things that you can do for free anywhere, anytime. And what other things do you have to recommend? Is this something that you actually have to put into your everyday practice as stress reduction, or can they regulate their cycles and all this and manage symptoms or get rid of symptoms? Can they do that without managing their stress?
Well, I guess it depends on how people manage their stress, right? I mean, I used to manage my stress by going for runs, and that was stress on my body.
Yeah, it's more stressful.
It's more stress. So personally, with my tendencies to not have a normal cycle and have longer cycles, I had to park my butt on the couch. So that looked like more reading books. I read a lot of books, right? That was productive for me to read books. It helped me escape if I wanted to, read some fantasy stuff instead of textbooks. So sometimes that stress is reducing the physical stress on your body. And that's hard for women, especially if we're programmed to do everything or have a certain body type or fit a certain size clothes and stuff like this, right? There's those societal pressures and pressures from social media to do. So I think depending on the situation is um, you know, more gentle movement practices, so breathing, yoga, more walk in nature. The more vitamin D we get from the sun, the better we are, more fresh air. My thing was reading. I had to sit down and read to let my body relax. Um, what else for stress? I mean, if cooking is therapeutic for you as it is for me, cooking really good meals that you know are going to nourish you, that's empowering as well. Making those choices for yourself and your family are important.
So do you think women are doing themselves harm where everyone's trying to be super thin and running all this on the treadmill and like you said earlier, maybe not even eating enough calories to run their basic body machinery? We all know that athletic women and gymnasts are prone to stopping menstruation completely.
Hmm
Is
hmm
is it a thin line here? Are women just pushing it, trying to be fit and messing up their hormones?
I think yes. I think there's a couple different ways we push it, but specifically, especially with the female athletes, and someone doesn't even have to be an athlete to lose their period with excessive exercising, right? It just depends on their stress tolerance, and everyone's stress tolerance is different because the way that we all reach homeostasis or hormone balance is going to be different. But I think at the end of the day, those stresses are what causes hormone imbalances. And so you talked a little bit about athletes. And so hypothalamic amenorrhea is basically what we know as the female athletic triad, right? Where there's excessive exercising, there might be disordered eating patterns, so under eating. There could be stress fractures or tissue injury that won't heal because we're not getting enough fuel and like low body weight, right? So that's the classic criteria for the female athletic triad. Now it's called REDS now. It's relative energy deficiency syndrome. And that's not good because that the second thing I said was they have injuries or fractures. When we don't cycle regularly, we're not building our bone health. And that is the single most important reason for me because I'm a chiropractor, so I work on people's spines. And when I see women come in, women who haven't had regular cycles their whole life or who were underweight, under eating, overstressed, and they come in with compression fractures in their spine, that's a hard thing to manage and it's a hard pill to swallow when that could have been avoided if they had been educated properly about their overall health and their cycles.
Is this because estrogen's a growth molecule, so that promotes bone growth?
Yes, so estrogen has impact on the bones to help them get strong and grow. Estrogen has an impact on our cardiovascular system. It actually promotes the elasticity of our blood vessels. So we see in women who have low estrogen or women who are in menopause, there's a higher risk of heart attacks there. And estrogen is neuroprotective, so it keeps our brains sharp. It keeps our neurons firing. So when women in menopause, when we see a lower estrogen profile, we actually see higher rates of dementia. So estrogen and cycling naturally for as long as we can is important for bones, cardiovascular system, and our neurology, right? Our brain health. And if you think about all those missed opportunities, so I think back, I was on the pill for 8 years. That's 8 years of missed opportunity for me to have natural cycles to grow my bones, right? To get my bones strong and have those beneficial physiological requirements to be a female. So that's where it becomes important, especially with the tissue healing, because we only have one body.
So I know a lot of the women who are listening will be more concerned with weight loss, but
Yeah.
there is going to be a handful in there who are really, really concerned with being real slim here. So I think I just kind of
Yeah.
wanted to point
Yeah.
out firmly that you're not supposed to be that slim. And
Yeah.
you were talking about basal temperature earlier too. Well, when you're
Yes.
that slim, your body's going to have a hard time maintaining a solid basal temperature,
Yes.
and low
Yes.
basal temperature is associated not just with low thyroid function, which is also going to be a probability if you're
Yeah.
quite slim. It Low basal temperature is also implicated in cancers and all
Yeah.
kinds of things.
I have a great example of that actually from my own experience. Last year, this time, I put myself on a calorie deficit to purposely lose weight. I wanted to get shredded for the wedding, right? So that was my goal. I knew full well what I was doing. I was charting my cycles. I was keeping track of my weight as well on my cycles. I was doing it responsibly. I was using an app, tracking my macros down to the T, and I reached my goal weight. As I was getting to my goal weight for the wedding, what I saw was my basal temperatures go down. Once those started to go down, I never saw my cervical mucus come up because my thyroid was down. It was shutting down my HPO, my hypothalamic pituitary ovarian axis, and I didn't have a period for 3 months because I drove myself into the ground, lost weight, my thyroid function went down, and I knew full well what I was doing because at that point, I was like, I have this goal. I'm not trying to get pregnant. I'm going to fix things when this is over. And so I was always cold. I had low libido. I had low energy. My bowel movements were more sluggish, right? We see all these things because we're not having enough fuel to maintain our metabolic rate, and then our thyroid shuts down, and so does our ovarian function and our cycle. So after the wedding, my goal was like, okay, we're married now. I got to get ready. I told myself the next year is just going to be replenishing my body and working on getting my cycles normalized. So it's been a year since it'll be a year next month, and my cycles are normal. So mission accomplished. But it took a year to do that after losing my period for 3 months.
Well, you look very healthy right now, shoulders up.
Thanks.
Just saying that, yeah, a lot of women are too obsessed with it. Need to relax a little bit. It's supposed to have a little bit more weight.
Yeah, and I'm just gonna shamelessly plug another book in here. So when I lost my period after the wedding, this book was my Bible. It's called No Period, Now What? It talks about all the causes of why you would not have a period. So why I know so much about PCOS is because I had to dig through the PCOS stuff and the hypothalamic amenorrhea and decide which was affecting me and how to go about that. So this is an excellent resource for anyone who has cycle problems. I loved this because I have some distorted eating pattern tendencies, being a woman with hypothalamic amenorrhea. And so this actually helped with giving a guide and a mindset on, okay, I actually need to gain the weight that I lost back to have normal cycles. I need to eat foods that maybe I wouldn't normally eat just to get my period back. I need to maintain a certain body fat percentage to have a normal cycle and be a fertile woman, right? So that was really a really good resource for helping that mental strategy to reach that goal.
What foods that you wouldn't normally eat?
Well, okay, I do think in this book, my opinion of this book was the foods that they were recommending to eat was junk food sometimes. They were saying no food is bad. If you want, it was basically saying gain weight so that you can get your period back. So, I mean,
So eat ice cream, eat whatever you want.
basically that's what that said. I am not the same type that way, but I think I had more, it gave me a sense of liberation from the strict rules that I had previous to losing my period for those 3 months. So that was nice. So now I enjoy going out to a friend's house, not caring what they're going to feed me, or if, for example, I'm coming to Kirkland Lake in 3 weeks to see my grandparents. And I mean, That whole week is going to be whatever they serve me because they're going to be serving me with love, right? And I'm not stressing about that because it's stress is going to mess up my physiology more than one meal will.
All right, all right. Okay. How does chiropractic come into this? Are these completely different disciplines here, or when someone comes to you with a problem, do you do both?
Yeah, so that's funny. So I kind of blur the lines a little bit, but I always say, if it's related to your physiology, it affects the world that it affects my world in terms of working on someone as a chiropractor because I always ask my females if they're cycling naturally, if they had normal cycles, if they've had hysterectomies where they've taken out uterus and ovaries, because the longer that my patient has been on hormonal contraceptives or the longer my patient has not had a normal cycle, then I'm more cognizant about the forces I'm putting through their bodies trying to either manipulate tissues or do adjustments because their tissues may be more vulnerable if they're not at an optimal bone mineral density. Does that make sense? So I would argue that someone's fertility and their cycle health is a big indicator on the forces that I apply through their tissues as I'm working on them.
Could you explain that more? I don't really understand what you're saying
Yeah,
there.
so remember how I said that estrogen is important for building bone?
Hmm.
hmm So if someone's not getting their dose of estrogen, if they don't have a period, if they don't have their ovaries, if they've had a hysterectomy, their bones are going to be more brittle than someone who's had a normal cycle their whole life.
So you've got to take that into consideration when doing their chiropractic work.
I take that into consideration for sure, especially if I have a woman who is just around menopause, who's been super active, who may have not had normal cycles her whole life and thought that was normal for her, or who's been on birth control her whole life, or someone who's had a bunch of kids back to back who never had the chance to replenish their body from mineral depletion. I'm worried about that because if I'm not careful, there's a risk of rib fracture or compression fractures in that person. And I need to know that.
Okay, so it is still basically separate, but you're just taking into consideration if they're going to have weakened
Yes.
bones.
Yeah. And I mean, I think I'm a little different in terms of I talk to my patients about nutrition a lot. I do a lot of nutritional recommendations in my practice. And so it's not like a formal nutrition coaching. That's what I'm stepping into now with what I want to offer people on the side, not as a chiropractor, as a holistic nutritionist, because I want to separate those two so that people get well-rounded advice for what they need, right? And not just table talk while they're talking to me while they're working on them. But it's also important if someone's not eating enough to have a normal cycle, they're not going to have good tissue healing if they're having a back injury or a tissue injury. So that conversation is very important to have.
Is there any chiropractic work that you could do that could help a woman get regular or help with any of these symptoms of any of these female problems?
Ultimately, I think it's like a stress and diet thing. I mean, obviously the physical stress of overexercising, like chiropractors, we do go and we help the body alignment, right? So we are working on the neurology. We're not necessarily sending signals to the hypothalamus to start firing for ovulation. If someone's depleted, it's going to take more than just that natural kind of repositioning of a joint. Um, but our job is basically education and optimizing someone's overall health by helping them get what they need, whether that's proper joint alignment or educating them on nutrition, right? So we are educators and facilitators.
Okay, I like that. Not a one size fits
Yeah.
all kind of deal. Okay, someone comes into you, woman, she's willing to do every single thing that you say. She's not even on birth control. She's not on any drugs. She's willing to eat all the foods that you recommend, avoid all the foods that you recommend, and take all the supplements that you recommend. How long do you reckon to reverse PCOS?
Okay, so reverse is a big one because I don't know if you could fully reverse it in terms of all the whole presentation. And I think it depends on the type of PCOS someone's presenting with. And ultimately, I think it's how long the person's been on a hormonal contraceptive. But you said if she has never been on,
Never touched it
never,
before.
okay. And if she's compliant with all my recommendations.
100%.
Okay. I would say, probably 6 months.
That's pretty reasonable.
6 months, because 6 to 9 months. And I'm only saying that because that's the period of time that I would work with someone to optimize their fertility before they were trying to conceive.
So you'd expect
And
them to
like,
be fully straightened out in that time, or mostly.
I would hope for that. Yes, I would hope that. So 6 to 9 months, because that's basically, we want to give the body the time to replenish and to try different avenues if a certain strategy won't work. So yeah, 6 months.
Okay, I'm working down my keywords here that I've got written down, and I know we're on the tail end of this episode here, so might want to speed up a little bit. So you mentioned earlier the testosterone needs to convert to estrogen, or is it the other way
Oh,
around? And is
yes.
that's in the liver, right?
So specifically what I'm talking about there is with PCOS and the effects of insulin on that. And so basically let me turn this off. Can you hear that beep? Sorry.
No, I didn't.
Okay, perfect. Um, with PCOS specifically is the increase in insulin or high blood glucose triggering hyperinsulinemia. It affects the way that the follicle in the follicular phase converts testosterone to estrogen, mostly because there's an increase in testosterone because of the stimulation that's happening with the imbalance in hormones. And so in women, testosterone is made in the ovaries and it's also made in the adrenal gland. So the testosterone that's made in the ovaries, that does not get converted to estrogen as effectively when there's higher insulin levels. And that's actually what leads to the formation of the cysts on the ovaries.
Okay,
Hmm.
okay. That makes sense to me. Again, I know a lot of listeners are not gonna
Yeah,
fully get it. It took me like 6 books to even understand
yeah,
follicles and stuff.
yeah. Physiology is very complicated, especially when you can't see it, but it's pretty amazing once we know what we're doing and can kind of manipulate what's happening there.
So the key there is the blood sugar. So this is my next question.
Yep,
Carbs. A lot of these
carbs.
books, or all of these books, basically, okay, most of them tell you to avoid high glycemic foods, foods that
Yes.
spike blood sugar quickly.
Yeah.
But yet, those foods aren't always a problem. Like we have a list of bad foods in our business, and a lot of the high glycemic foods aren't on it. Like, we're not telling you to
Hmm.
eat
Hmm.
rice, for example, breakfast, lunch, and dinner, but it's not a bad food to us. But it is one of those foods that will spike blood sugar very quickly. So yeah, that's my question. Are you against carbs? You mentioned you're very fond of
Um,
meat and organs.
yes. No. So we love carbs. We need carbs, right? Oh, I mean, some people would argue that we don't need carbs, but personally, my opinion, I like carbs. Um, so with PCOS, the issue here is that we're trying to regulate blood sugar spikes, right? So we're trying to reduce those blood sugar spikes to control inflammation and insulin dumping, right? So the recommendations there are choosing lower glycemic carbohydrates, right? So more whole grains. I mean, like, whole grains can be inflammatory, but if we're going to do whole grains, we want to make sure that they're sprouted or soaked so we get as many nutrients and minerals from them as we can. My favorite type of carbohydrates are from vegetables, right? So things that grow in the ground.
Like what
So
vegetables? Cruciferous, carrots.
so they all have carbohydrates, right? So vegetables, those are like they get grouped with carbohydrates in my household. So potatoes, sweet potatoes, cruciferous vegetables, all the squashes, they're lower carbs, right? The squashes, but they still give our bodies a source of carbohydrates that are more complex and they come with more fiber, minerals, and nutrients. So I'm always in my head, I'm like, okay, if I have two options, I'm always going to go with the one that packs the more nutrient content. So energy density or nutrient density is my goal here. But with PCOS, we want to try to minimize that blood sugar spike. So our strategies there are lower glycemic carbohydrates, pairing a carbohydrate with fat and protein to slow digestion, or actually saving the carbohydrate for like the last back end of that meal so that the carbs and fats goes first to slow down digestion, that sort of thing. With PCOS, it is helpful to eat a lower carb diet. That's actually been shown. It's not as helpful as eating a ketogenic diet, right? But adherence to diet strategies is important. So choose something that works for you.
Yeah, you got to be able to keep up keto.
Yeah.
And I
Yeah.
literally know one human being who's able to be
Yeah.
permanently keto.
Yeah. And so we want to choose something that's sustainable, right? So I don't really love the word diet, right? There are eating strategies, and you got to choose one that's right for you. So right now, for me, on the journey that I just track my macros, right? Perfect. I've done paleo before. I've done super low carb, all that. And so another strategy that they talk about in Real Foods for Fertility is to, and also any PCOS stuff, is to like front load your day with a higher calorie intake. So whether you're doing lower carb, just eating the bulk of your calories earlier in the day. Let's say we do like, I don't know, 60% of our calories in the morning, a smaller percentage at lunch, and a smaller percentage at dinner. That just sets us up so that we're just seeing an overall less increase in our glucose levels throughout the day, which we don't want a blood sugar spike before bed typically, right? We're not even active in the nighttime, so we want to make sure that we have lower calories going in the evening. That's the recommendation there. So it kind of is similar a little bit to a fast because we're giving the body the time to digest and do its job overnight. But front loading the day like that with higher calories in the morning, or sorry, or the more bulk of our calories in the morning versus the evening, actually helpful for changing around some of the symptoms related to PCOS.
I agree with that too. Many
Yeah,
people say that. Eat breakfast like a king or queen and
yeah.
lunch like a prince or princess and eat
Hmm.
dinner like a pauper. I do agree. So you mentioned guts. You got to have good gut health. We're not going to be able to go into super detail on everything here. We've done
Yeah.
other episodes, and Dr. Ashley, you're always welcome back for a part two
We
as
can
well.
certainly do a part two.
Because yeah, you got to have good gut health, and we're not gonna be able to go into that. You
Yeah.
need probiotics, you need enzymes, you got to be off foods that damage your digestion system. If you don't know what foods those are, you got to do a food diary. I would say
Yeah.
that gluten is probably going to be your most likely thing that is messing up your guts. If your guts are messed
Yeah.
up,
And
you
I will
get
say something too. I don't want to interrupt you, but hormonal contraceptives disrupt the microbiome,
yep.
right? So step one is clean that up a little bit by the cessation of that if that's a choice that you're willing to make. And so that's a really good start to clean up gut health is get ridding the body of the exogenous hormones.
Absolutely excess
Yeah.
hormones, and you don't have to go carb free, but maybe front load. I like that word, front load. I don't think
Yeah.
I've heard that
Yeah.
before. And you mentioned the thyroid. I just want to say too, if this is getting confusing for people, your blood sugar, your thyroid, your brain, your hypothalamus, your pituitary, your adrenal glands, all of these organs need basically the same nutrients. Nutrient deficiencies
Hmm.
could cause any of these problems. It's going to be slightly different nutrients if we're talking about the thyroid or blood sugar, but it overlaps a ton. Like you need B vitamins for all of it, for example. You need minerals like chromium, vanadium, zinc, magnesium. You need that for your blood sugar, your body to utilize insulin properly. You also need that for all of your glands to work properly, including all the female glands and all the glands that we
Hmm.
both have, thyroid, all that stuff. It all needs basically the same stuff. So nutrient deficiencies can impact all that. And at the fundamental cellular level, the blood sugar problem is going to be essentially a nutrient deficiency. If you have if you're eating lots of sugar, it's going to exacerbate that, right? You need nutrients to like people blame diabetes and this metabolic syndrome on sugar itself. I just want to say, and it's in my book again, everything you should know about healthy blood sugar. And all of my books are on my website, notusbooks.org, and all of that's in the description as well. I just jump in here because people blame sugar, and it's not just sugar. We need nutrients to handle the sugar. We need it to metabolize the sugar. So if we're eating a bunch of sugar and we're already nutrient deficient, it's going to increase the nutrient deficiencies until you really run dry and you have diabetes or any of these other chronic problems. These are more severe symptoms of nutrient deficiencies
Yeah, well
in the
said. And I
long
like
term.
that because when we are consuming those higher sugar foods in the diet or processed foods, we're just kind of we're not holding space for the nutrient dense stuff, right? So it's
It's
that
the
choice.
opposite of nutrient dense.
Exactly. So I mean, it's one or the other. So if you're choosing, always opt for the more nutrient dense option. It's just better for your health.
And everything that you recommended, I like all that stuff. Organs and vegetables, definitely. Vegetables are becoming underrated for some reason. People
Hmm.
are turning against vegetables, and it's nuts. We need vegetables. One of the last questions here: how do you feel about the phytoestrogens in the food supply or in the cosmetics and stuff? And what do you think are the most important ones?
Okay, yeah, that's a big topic. So you
Because
mentioned
you talked about the benefits of estrogen, or like you've mentioned them, like we need it for growth and we need it for bone density and all that
yeah,
kind of stuff,
yeah.
but
So
we don't
I
want too
mean,
much.
yeah, we don't want too much. I think it just source depends on source. So for example, one thing that I do daily, have you heard of seed cycling before with
I,
women?
I have.
So some people recommend seed cycling to get your cycles back. There's actually no evidence that the different types of seeds help. So specifically like flaxseed, pumpkin seed, sunflower seed, it actually is effective just with flaxseed. So I grind up flaxseed and just put it in a mason jar in the freezer. I just have a tablespoon a day just to help with cycle regulating. So I found that my cervical mucus actually hangs out a bit longer and stays a little bit better with the flaxseed. So that's something that I implemented and I'm just sticking with it because my charts look healthy now. So that is like about the only phytoestrogen thing that I will go near. I don't love soy at all. So I avoid anything with soy in it. And then the other biggest thing is just xenoestrogen. So that's cosmetics and plastics and stuff, right? So I'm always making sure people are cognizant about what they put on their skin because our skin's an organ and it absorbs and brings into our body what we put onto it. So we think about phytates, right? Parabens, all these different chemicals that are in shampoos, conditioners, makeup, hand creams, our laundry detergent. We want to be careful with what we put on our skin because exposure to xenoestrogens is going to increase estrogens in the body and cause hormonal disruption. One thing I'm very, I guess, cautious about, I do it because we live in a world where there's just a bunch of receipts, but receipts actually are a really big source of xenoestrogens. They have this little filter, not filter, they have a chemical on it to make the ink print easy on it, but that actually touching receipts is a really big way to get a dose of xenoestrogens and hormone disrupting chemicals.
Yeah, some posts have been going viral about that.
Yeah. And it's even worse if you put hand cream on before because it opens your pores.
Wow.
Not hand cream, sorry. What am I thinking of? Hand sanitizer because the alcohol,
Okay, yeah, yeah.
right? So that was like a big thing with COVID and all the hand sanitizer stuff. It was like, I'm not doing hand sanitizer because I have to touch receipts and uh-uh.
Yeah, just shopping receipts. Yeah,
Yep,
that's a real
yep,
thing. Can leach
yep,
chemicals into your
yep.
skin. Now, I gotta tell you, Ashley, Dr. Wendy Sellens is not going to be happy about this flax thing. She's
Oh,
super against flax, and
oh
this
yeah, okay.
that was the first time I'd heard it myself. And we
Yeah,
even sell some products with flax in it, so
yeah.
I'm kind of
Interesting.
I'm still absorbing that information. You're a
Yeah.
reader. You might want to check out her books too. She's got two big, huge books. One's called Breast Thermography
Okay.
Revolution, and the other one is called Soy Boys, which is an
Mm-hmm.
excellent title. And
Yeah.
yeah, she's just super against flax. I'd We're not going to go fully into it. We went into it on the episode with her
Yeah,
recently.
that's
Maybe
fair.
you want to check that out.
Yeah.
But I know there's a lot of different opinions floating around about the phytoestrogens. I
Mm-hmm.
never put that much emphasis on it myself. I was just we go in order. We fix the digestion first, and then at the same time you're getting off the bad foods.
Mm-hmm.
Hopefully you're doing it, and then we just pump in a bunch of nutrients, 90 essential
Mm-hmm.
nutrients. We do try and customize it as much as we can, but I don't really tell people to avoid or pay attention to phytoestrogen. I just leave it out of the conversation. for the most part. And I think that might not be the best thing on my end. I might have to go in and say more about that. But a lot of the women that come to us, I don't know about you, are very educated already, especially from Instagram. Most of our people come from Instagram, most of our customers, and
Hmm.
they're pretty on top of it. A lot of these, especially the women, they are very well educated and researched. They have been trying for years to fix their problem. Usually, we're just there to fill in a couple of gaps that they might have missed, certain nutrients and stuff like that. But a lot of them already do avoid seed oils and already are aware of the estrogen mimickers in food, and so a lot of them
Hmm.
do avoid that, and that's good. We can go into more detail about all of that in the future. Lastly, you mentioned iodine with the organs being a good source of
Hmm.
iodine. I have recently, only in recent months, started to use mega doses of iodine along with our normal program, which already included all the other nutrients that you need for thyroid specifically,
Hmm.
like selenium and the B vitamins and zinc. The whole list. We basically had the whole list covered, except I discovered that we didn't have high enough doses of iodine. And I've been really cranking up the doses and getting excellent results, especially in the female problem category.
Hmm.
So quickly, what do you think about iodine? Do you use
Well,
supplements for it too?
I'm trying to think. I don't think I use supplements for it, but I mean, yeah, I'm very, like I said, like I take three supplements daily. That's about it. Vitamin D, K2, NAC, and magnesium. I try to get a lot of my stuff from food. So I have liver daily.
Daily.
Daily. Yeah. Yeah. We make a meatloaf on the weekend, like when I'm meal prepping with ground beef, ground pork, sometimes ground pork, and I just puree liver. Sometimes I puree kidney, which is an excellent source of selenium and iodine as well, and I just mix it into that. And my husband and I have that meatloaf every day for breakfast, along with I do roasted vegetables. I'm a very atypical breakfast eater, but I like to get my nutrients and front load my day, right?
Dinner for breakfast.
Dinner for breakfast. Yeah, I just nutrients for breakfast. I don't even care. It's just nutrients, right? So, um, liver every day. We live by the ocean, so seafood is an excellent source of iodine. Seaweed, excellent source of iodine. So, what I like to do typically is we'll get dried seaweed or dried kombu, and when I make a bone broth, I'll put a couple nice long strips of dried seaweed in there, so the iodine will mineralize into the water. And then once that strip's nice and once your broth's done, it's actually nice and edible. So we'll just chew on the seaweed, and our broth has been infused with all of our minerals, including the iodine, which is excellent. And then sometimes if I'm just really lazy about it, I will just munch on seaweed paper while I cook, right? Dose of iodine.
I recommend the seaweed too, and I was recommending it strongly for a while, but
Yeah.
then I realized that no one was doing it.
Oh, yeah, it's a taste, right? The other source of iodine too is if someone's okay with dairy is dairy from grass-fed cows. It's a good source of iodine because farmers know that cows won't make good babies if they don't have iodine. So sometimes the cows are actually supplemented with iodine, or if they're getting a proper diet of like pasture grass and stuff, there'll be a good source of iodine there.
All right, Dr. Ashley, this 2 hours went by very, very quickly.
It
Do,
did.
do you have anything that you've been waiting to say, waiting for an opportunity, or anything pertinent that you think the audience must know before we sign out?
I think I said a lot already. There's so much that, I mean, we'll just have to do another episode.
We can. Would you like to promote your business here? Very few of our audience is in Canada, but if you happen to
Yeah,
be in
yeah.
Vancouver, are you guys accepting clients?
So Canada-wide, if someone likes to work with me on nutrition, specifically fertility nutrition, whether that's preconception, postpartum, or coming off hormonal contraceptives, um, I will send a link to you, Ryan, that you could add to the show notes if they want to join the wait list for my offerings. And I could be a support for them with that. I have a freebie as well that we can link to the show notes, and it's the post pill or hormonal contraceptive fertility reset. And it comes with recommendations, both nutritional supplementation and lifestyle to support replenishing nutrients after coming off hormonal birth control.
Awesome. I will put those links in the description as well as your social media, your Instagram handles, and all that stuff. Dr. Ashley Burton, I'm very grateful for you joining me today. I learned some things as well. It's a very interesting topic. Women's health, it's quite a bit more complicated than men's health. Honestly, the whole follicular stimulating hormone and stuff, it can get pretty tricky. It's boggled my mind a little bit, but I think some women got some practical steps here. And a lot of people do know about these seed oils and all this stuff, but they just don't really do it full. So maybe just like you said, step one, being a little bit more educated, now allowing you to say, okay, you know what, I'll start to be real serious about the seed oil thing and cut them out and see what happens. And since this has become a very popular topic in the last like 3 years, I think we've had a ton of people report benefits on that. Like they still have something left. That's why they're coming to us. But a lot of people have seen a lot of things get a heck of a lot better or completely be eliminated just by removing the seed oils. It's becoming bigger than gluten these days. You know, we get more people these days that are avoiding seed oils than they are avoiding gluten, which is interesting to me, but it's good. I think we should avoid both of them, but that's neither here nor there. So thank you once again, Dr. Ashley. And of course, remember, everybody can find everything that I do on my website, notusbooks.org, including the books that I've written and helped publish, and the free audiobook versions of all of my books, as well as hundreds of book reviews. Most of them are about health, and an archive of this podcast as well is on the website, notusbooks.org. You can download the episodes there for free. And I think that's everything for today. Thank you, everybody, for joining. Thank you, Dr. Ashley.
Yeah. Thank you for having me.
Stay healthy, my friends. Until next time.